Hi everybody, Peter Forsyth from Moffitt Cancer Center, talking to you from the wonderful ASCO meeting in Chicago. I'm just going to tell you a little bit about our poster, which I think is pretty interesting. We work on this problem called leptomeningeal disease, which is a horrible problem. Patients live only a couple, 3 months. So we're doing a trial where we understand something about the biology of the disease and have a trial that's kind of matched to the biology. This is a bit important because it was unbelievable to us, but leptomeningeal disease is kind of an inflammatory disease, so we didn't really appreciate that before. So this is an example of all the different cell types that are present. And those are just the immune cells, and this is all in mice, of course. So there's a whole bunch of monocytes and macrophages, and there's hardly any B cells, there's some DCs. And then the mice, we cure most of the mice, so these are the tumor cells at the beginning before they're treated, and then after they're treated, there's basically no tumor cells. And then somewhat interestingly, which we haven't figured out yet, as you can see, it remodels the immune landscape. And it takes it from innate, patients have this ineffective innate response that kind of attacks tumors. It's mediated by NK cells, so it's not on its own enough. So we think that when we remodel it, that we're able to turn the immune response into an adaptive immune response. And we're sorting out the details, so we're adding to the defenses patients have with a more effective defense. That's kind of shown by this huge increase in B cells. And the mouse where it shows that most of the mice are cured, and then, we don't have it on this. Oh, and that they're TH1 CD4 dependent as well as B cell dependent. So we know that the B cells are super important. In the meantime, we have this study going. The schema is here. So patients with breast cancer that have triple negative or HER2 positive breast cancer, we basically administer either the HER2 or HER3 peptide intrathecally right into the Ommaya reservoir, kind of once a week for 6 times and then repeat it a couple times. So we think the biology is super important, and this study, this clinical trial is based on that biology. So far we've treated 5 patients, and the results are, there's no dose-limiting toxicity, which is really good. And when we've looked at some of the cytokines, we know that it has this tremendous cytokine response. So the stuff we're putting in is doing something, we're sure. So, it's really exciting. I think it's an exciting thing in Moffitt where we can bring these discoveries we make in the lab and use immunocellular therapies to attack these deadly cancers. So it's super exciting for me to be able to do this work and to offer this therapy for patients. And we hope it's going to help them. We're pretty sure it will, but we need to do the work and figure it out.